Good evening, colleagues. Let me take this opportunity to welcome you all. I hope you can hear me well. My name is Thabang Serolela. I am the manager in CPD and registration unit. And today we will be facilitating this first workshop for Intern Tutor Workshop in 2022. And we really appreciate your attendance. Please familiarize yourself with the information that is displayed on the screen, because it's very important for you to take note as we will be continuing with this workshop. And then again, I just want to announce that I'm with my colleagues from the Office of the Registrar, Mr. Mokwadi Moranu, who is the Senior Manager in CPD and Registration Unit, Ms. Raisibe Madirwe, who is the Manager in CPD and Registration Unit, Ms. Deanne Johnston, who is the Manager in Pre-Registration Unit, and Mr. Tumelo Mdau, who is also a Manager in Education Unit. In addition to that, we also have representatives of assessors and moderators, and we have Ms. Adele Nodi and Ms. Thokozane Mhlahlane. And they are both intern CPD assessors. And we also have colleagues from the Office of Communications and Stakeholders Relations, and they are here just to give us support in terms of communication. Please note that our workshop will be divided into two sections. The first section is on general requirements and conditions for internship, and it will be facilitated by the Office of the Registrar. And the second section will be on CPD evaluation, and it will be facilitated by the representatives of the assessors and moderators. I just want to highlight one point from the welcome message that is displayed, which is about the survey. Please note that you are all requested to complete the survey, since it will be serving two purposes: as a proof of attendance and also for rating the workshop. Even if you don't want to participate in rating the workshop, please just complete it with your PIN number and your names, just for us to be able to add you to the list of the attendees. And with these few words, I just want to say welcome to our workshop, and I wish you all the best and good luck with all that will be happening here. Thank you. And then we will be moving to the first presentation. Okay, I'm sorry, let me get... Okay, yes, thank you very much. It's still me again, Thabang Serolela. I will be taking you through the first part of the workshop, and which will be focusing on introduction to pre-registration. And yes, let me start by taking you through the program. This is what is going to transpire this evening. We started a few minutes after 8 o'clock, and I just want to apologize that we had a glitch that we were to resolve before we can start. And then the introduction to pre-registration, that's the part that I will be taking you through. And then after that, we're going to have pre-registration evaluation, which we will continue with it until 7:30, where we will take a short break for 10 minutes. And then after the break, we will continue until the last item, which is closure. Okay, and the outline for my presentation, it goes as follows. We will look at the framework, and then which will be followed by evaluation, and then we will also browse through the SAPC website, CSP, which is Community Service Pharmacist registration, and we will also look on how you can contact the Pharmacy Council. So that will be the end of my presentation. Okay, with that, let's then move on to the first part, that is the legal framework for pre-registration. Registration with council is mandatory for all interns, but there are a few requirements that needs to be met before an intern can commence with internship. And the first requirement is that there must be an approved premises, and then a contract with approved tutor must also be there, and the payment of the prescribed fee. So all these documents need to be submitted to the office of the registrar in order for the person to be registered as an intern. And one needs to complete a period of 12 months of practical training as an intern before you can be registered as a pharmacist. So those are the requirements for one to be registered as a pharmacist, which is important to take note of, although the first one I believe you have already satisfied. And then the scope of practice of pharmacist intern. As pharmacist intern, note that you performing the scope of practice that is exactly the same as that of a pharmacist. The only difference is that you functioning under supervision of an approved tutor. So make sure that your tutor, you have an approved tutor, because that is a minimum requirement for you to function. And interns in manufacturing or academia, they must complete 400 hours of supervised practice in approved community or hospital or institutional pharmacy. So all interns who are in manufacturing, they need to have the 400 hours done in those sector of pharmacy. And the 400 hours it means that you're still functioning under the same tutor. All you need to do is to arrange with either the community or the hospital pharmacy, and you need to be there for a period of at least 5 consecutive days, and always keep records and make sure that the supervising pharmacists submit the progress reports online. And there's no need to get a new tutor. You continue with the tutor. It's just that you will be supervised by a different pharmacist in a different sector. Again, the rescission of contract. So internship contract may be terminated on mutual agreement between the intern and the tutor. The following must be done to avoid delays on completion of internship. So what is important is for you to submit the online application, the new contract with the approved tutor, and that should be done 7 days prior to the cessation date to cancel, and you need also to pay the prescribed fee. And please note that cessation will be approved only once the new premises and the tutor are approved by council. Then now we're moving on to the pre-registration evaluation. The pre-registration evaluation consists of 3 components. That is the pre-registration examination, the CPD portfolio, and the progress reports. So for today, we will be focusing more on the CPD portfolio. And there will be pre-registration examinations, workshop somewhere during the course of the year. So we will be just touching a little bit on it. And these three components of internship, they need to be satisfied during the 365 days of supervised practical training. And then with regard to the pre-registration examination, please note that you will be booking for the examination online, and which will be an open book. And it will consist of 120 questions, 1 mark each. And for the general practice, you need to obtain at least 70% and 30% for calculations. And the pass mark will be 50% for the general questions and 60% for calculations. And then with regard to CPDs, you are required to submit 6 CPD entries. And please note that it will be 1 outcome per domain. And for domain number 5, please note that the competency standard 5.3 is compulsory, meaning you are not going to choose 5.1 or 5.4 or something like that. All interns are required to do competency standard 5.3 under domain number 5. And then the results will be released 1 month from submission deadline, and result for entries submitted after the deadline will be released 1 month from the subsequent submission deadline. And resubmit all entries not yet successful so that you can be found successful on those ones as well. And at the end, you are expected to be deemed competent, meaning you are only competent or CPD competent after you are successful in all 6 CPD entries. As long as there is one that you are not yet successful on, then it means you are not yet competent. And then institutional and community interns are required to submit 7 progress reports, whereas manufacturing, they are expected to submit 9 progress reports, academia 3. And with the academia, they are also expected to do the 400 hours declaration, just like the manufacturing. And they must, the academia interns, they must also achieve master's qualification and submit the favorable release report. Oh, I'm sorry, I'm being challenged here. I'm sorry. Okay, I'm sorry for that. And then how do you apply for community service? Interns are to apply for online, to apply online for community service, and this can be done by interns who are CPD competent, because the placement is only for those who met the minimum requirements. So more details on the applying for community service will be provided during the workshop that will be taking place sometimes during the year. And then CPD submission deadlines. Please take note of these deadlines. And this year we're going to be very strict. All the CPDs submission deadlines and the release deadlines, we're going to stick to them. So make sure that you don't miss any, because we're not going to be lenient when it comes to this one. And we have increased the number of submissions from, I think we increased it to 8 this year, just to give you more opportunity to submit your CPD entries. That's why we're saying we're not going really to do any one of you any favor. These dates are also published in your intern tutor manual. Please take note of them. And what is important for you to note is that according to council policy, appeal must be submitted within 1 calendar month after the release of results, and there will be no CPD assessment in December. Entries submitted after 28 October 2022 will only be assessed in January 2023. And then entries submitted after the deadline will be assessed and released on the next subsequent submission deadline. And when CPD entries are released, please, sometimes the results, they don't become available immediately. So please give an allowance of at least 48 hours. And if you're not seeing anything and you know you have submitted within the submission deadline, please contact the office and we will be able to assist you further. And then please note that on submission of the 10th and subsequent CPDs, a fee determined by council will be charged. And please check on the council website, the fees are published in there. Okay, and then this year we have introduced what we call a CPD feedback session. The session will take place in June, on the 7th of June and on the 8th of June. And the purpose of these sessions are to respond to intern CPD queries, to share assessment experience, and also to guide interns on how to improve the quality of their CPD entries. So what is going to happen is towards the date of the CPD feedback session, you will be reminded so that you can do the booking, and we're gonna have a session more or less of this nature just to assist. Hello.
Tabang, we can hear you. We can hear you now,
Okay.
Tabang.
Okay, thank you. I'm sorry, it's raining heavily at my area and it's affecting the connectivity. I'm sorry for that. I was still on the exam dates and I was indicating that they are there in your intern tutor manual. Just make sure you familiarize yourself with these dates. What is important for you to note is that there will be a practice exam which you are all required to participate in order for you to be admitted in the pre-registration examination. The first one for this year has already passed on the 20th of January. So there will be one on the 2nd of June and on the 18th of August. And the dates for the pre-registration examination, they are also there in the table. And yeah, this is what is important. And please note that all exam bookings must be done online before the closing date. And late booking fee will be charged after the closing date until 14 days before the examination day. So the dates, I mean, for closing of the closing date for online booking, they will be communicated with you once the bookings are opened. Okay, and then the exam entrance requirements. This slide is very important, colleagues. Please make sure that you pay attention. And all interns who will be on their 6th month of internship, they will be able to qualify to sit for the exam, meaning anybody who's less than 6 months of internship won't meet the criteria to sit for the examination. And in addition to that, the intern should have submitted at least 6 CPD entries online and be competent in at least 3 CPD entries. And they should have also participated in the practice examination, as I've already mentioned. And the tutor must have submitted 3 progress reports. And once all these things are in place, then the intern will be able to book for the examination. And then interns who are on their 9th month of internship will be expected to have submitted all 6 CPD entries, and they must be competent in all of them. And also they should have completed the practice examination and submitted 4 favorable CPD entries. And anybody who will be reattempting the examination, they are also expected to have passed all the CPD, the 6 CPD entries, and all the relevant progress report should have been submitted. So there's no exam fee for the first and the second attempt. Fees will be charged on the 3rd and subsequent attempt. And note that your tutors will have access to intern overall results. And this is what I was talking to. So now let's look at the SAPC website. I believe the fact that you managed to book for this workshop, it means you have already started navigating the website. So there on top, that arrow is showing the address. And then when you are already in, when you click where it's in red, manual, this is where you will be able to access the 2022 Intern Tutor Manual. And then there is also a click here at the bottom there on the last line. That one will take you to the CPD user manual for interns. So whatever we're going to be talking about with regard to submission of CPDs, you will also find it under the CPD user manual by just clicking there. Okay, thank you. Okay, and then once you are able to enter the secure page after you have logged in using your own details, you will be at this page, which will show you the dashboard, annual declaration, CPD manual, and everything. This is the page that you will be using mostly when you're doing your CPDs. And the first thing that you need to do before you can start submitting your CPDs is to do an annual declaration. Unfortunately, the system won't allow you to do CPDs until you have done the annual declaration. And then once you have done the annual declaration, then you'll be able to progress to start entering your CPD activities online. And then other functions are there when you want to check your finance, your balances, when you want the letters and certificates, when you want to book for the workshops, everything that you will need is there for you. And then, like I said, you must start by completing the annual declaration. And I believe most of you have already done that. And then once you are done with the annual declaration, I mean, when you are on that, it will show you this is a new declaration. So once you start putting in your details, it will show the year you are declaring for, the date, and so forth, and the role, which will be an intern. So that information, I think, is straightforward. And when you go to the user manual that I've directed to you to, you will find all the information. And then this is part of the declaration wherein you need to give your employment information. Once you are done with that, indicating which sector are you and so forth. Then you will also be required to choose the domain. And then once that is done, you will then do be taken to the assessment criteria. So when you're doing selecting the domains, if you can say you don't do this for all the domains, then when you come to this, the system will automatically declare you as non-practicing. But if there are those that you have selected as you are doing them, then it will bring this screen to say, according to your competencies, you are a practicing pharmacist. So then you will agree there. Then once that is done, then you can start loading your CPD activities. And then with the CPD, please note that it is a 4-step cycle. And then you are to do all the steps before you can be able to submit. The pharmacists, they're having a 2-step cycle, but that is not applicable for you as interns. So make sure that you do your 4-step cycle in all the 6 CPD entries that you will be submitting. And then these are the domains that are there. There are 6. You will see them in the manual, and the assessors will also be touching more on them. And then the 4th step for the CPD cycle reflection will be the first step, wherein you are expected to identify a new learning need. And then once you are done with all the steps of the CPD, this is the CPD submission page, wherein you will be able to submit. If you can look at the bottom there, it shows that you can submit for verification, and after the assessor is done, the results are released, you'll be able to access your report under the red dot there under report. So make sure that you familiarize yourself with this page. And then it also shows the date on which you submitted for tutor verification, the date on which the CPD was submitted for assessment. So it's always important to make sure that you do it according to the deadlines that I've given you. And then, like I said, the CPD is made up of the 4 steps. Under each step, you'll be able to submit when you're done, or to save, and it allows you to go back in case you want to add something until you are done with the 4 steps. Then that you can submit. And then these are the 4 steps that I was just talking to. That is the reflection, the planning, implementation, evaluation, and then submission. Okay. And then we looked at the dashboard already, how it looks like. So this one, we have already touched on it. And then this page is also important when you're booking for the examination, and also to view your examination results. So make sure that you also familiarize yourself with this page, because you're gonna need it for your exams. And then the progress reports. Remember, you are to submit the progress reports the number of which will depend on the sector of pharmacy where you are practicing. So that is also done online. So all this information with regard to the SAPC website, you will find it on the website as well. And then please note that there is an annual fee for interns, which is payable by the 1st of June of each year. The fee is 116 Rand. And you are reminded to pay that fee by the 1st of June. And then internship must be completed within 12 months, wherein if not, a new employment contract then need to be submitted, because the one that we're having is only valid for 12 years. For 12 months or for a year. And employees employers are only able to reserve the intern position for the period of the contract, meaning after 12 months, the employer is not really forced to keep you. If they want to end the contract, they can do so. There's nothing that is really stopping them from doing that. And it means the intern will have to go and look for a tutor and for another premises to practice in. And then intern progress is made available to intern on the secure site, to the employer, to the tutor, and the NDOH. Remember, NDOH need to know your progress in order for them to place you for internship. And the employer has also to have knowledge of what is happening with the people that are employed. So all those have access to your progress with regard to internship. And then sometimes the release of the results are delayed, especially the CPD results, because submitting CPD entries after October submission deadline, like we said, there's no assessment that will take place in December. And then non-compliance in 6 of the 6 CPD entries will also delay you from being released from internship, and also failing the pre-registration examination or not having completed the 365 days of practical training. So make sure that you satisfy all those requirements in order for you to be released after your 12 months of internship. And then submitting CPD entries on time to avoid disappointment. We have already touched on this, that you need to submit on time to avoid you being delayed from being released as an intern. So I'm not going to touch on this again. And then we experience some unprofessional conduct in the office from some of the interns. And some of the things that we are experiencing is the interns that are contacting the assessors or moderators to pressurize them to mark CPD entries. Please note that this is not acceptable. The assessors and moderators, they are having their own deadlines from the office, which they are expected to comply with, and they are not expected to do any intern any favor. So you are requested to make sure that you do your things on time to avoid situations like this. And also, do not threaten the assessors and moderators for marking of CPD entries. Unprofessional behavior will result in disciplinary actions being taken against the intern. So this is important, colleagues. Make sure that you do your part to avoid you being, taken into disciplinary procedures, because it's not a nice experience. So let's try to be professional in everything that we're doing. And yeah, when you want to contact the South African Pharmacy Council, there is interns at sapc.za.org. This is the one you can use when you want to submit or to contact the office, and your query will be attended to within the expected period of time. And also, this is how you will submit your query. You will select whether it's a CPD related query, whether it's a finance, and you provide your details there so that the office can be able to go into your profile and be able to assist you. And yes, this brings us to the end of the presentation. I was just trying to go a bit fast because all the information that I'm sharing with you is there in your manuals. So please make sure that you give yourself time to go through the manuals, and so that you don't miss anything that is for you to note. And then you can also contact us at customer care at sapc.za.org, or you can use the landline numbers there, or at official SAPC. Those are the other platforms that you can use. And thank you so much. Now I'm gonna open, gonna take the questions. Okay, colleagues, you are requested to post your questions because we're not going to have we're not going to allow you to ask verbally, but we will be attending to all the questions on the chat. So you can start posting your questions. Thank you. It seems like there are no questions for now. And there is the first one. It says, good evening. Do we attach evidence for CPDs at the same time as submission? Okay, yes, for your, when you're submitting your CPD entries, you are requested to attach the evidence. I think it will be on the implementation phase. That's where you will have to attach your evidence. You will get it clear when you go through the guidance document that I've referred you to. Thank you. And then there is a second question. What is the 116 for? When is it payable? Is this in addition to what we already paid? Yes, what you have paid up to so far is the registration fee for you to be registered as an intern. And there is an annual fee that you are to pay by the 1st of March. I know some interns, they have paid both the fees at the same time, but if you didn't pay, you're having up to the 1st of June to make that payment. Thank you. I think these were the only two questions that we're having. Interns will just continue to post if they are having questions, but in the meantime, I will hand over to my colleagues just to save time so that they can start with the presentation on the CPD evaluation. Thank you so much, and over to you, assessors.
Okay. Thank you, Tabang. I think it will be me and Adele. I'll just try and load the first part of the presentation. I just want to check if my mic is audible. At this point, I don't have any feedback. Okay. Is my screen visible at this point? I'm on the first part of the screen. Can everybody see my screen?
Yes.
Okay.
Yes.
All right. Good evening, ladies and gentlemen. My name is Thokozani Muhlahlana. I'll be going through the intern and tutor training. We'll be going through the CPD system, and we'll be looking at the content on what needs to happen in our internship portfolio. So the outline of the document will pertain to the competency standards, that we have in our CPDs. We'll be looking at selecting a domain, selecting a competency standard, and then we'll also be going through in detail the CPD cycle. We'll be looking at... Am I having feedback?
Yes, may you please put your presentation on slideshow so that they can see better.
Okay. Let me see. Is this better now? Are we having progress?
Yes, yeah, that's better now. Thank you.
Okay. I'm going to the second slide. Is that also visible from your side?
Yes, it is. Thank you.
All right, thank you for that. As I was saying, we'll also look at assessment and what feedback you're going to be getting and what kind of feedback you will be receiving from the assessors, and also the aspects of reassessments. Ms. Kholela has already spoken about professionalism, but also the other thing we need to talk about is confidentiality, and also the types of competency standards that we have, some of which may be challenging and some of which we feel that they might be easier than others. They might be less challenging. And then we'll also look at the role of a tutor, what our tutor is supposed to be doing for us, how they need to verify our CPDs before they actually captured or passed on to the assessors. And then I think maybe, please, I'd like to give us this opportunity to look at our CPD to intern and tutor manual. It's available on the Pharmacy Council website. I think it will be under the registered persons. When you log in tab, it will be under the registered persons tab, where you'll go under intern and you'll be able to look at the document. Hopefully, most of you have got the manual in front of you. I think I'll give a minute or so because there's a lot of references that we need to be on the same page as we go through the CPD cycle. So things that I might touch on during the presentation, but you've got a very detailed account in your manuals. Remember, your manuals, you will have them. They are the ones that are going to be assisting us during our CPDs. So I would like us to please, at this point, turn on our 2020 intern and tutor manual so that we'll be able to follow accordingly. The areas that I think I want to touch on, I think maybe let's look at the pages 33 to pages 35, and that looks at the criteria for assessment of a CPD area. So you need to look at pages 35, pages 33 to 35, and then very, very important, a checklist for the CPD. So this is like a summary, but a very detailed summary of a CPD. So before I decide to look at a CPD, I need to always try and check what do I have on my CPD checklist. And that is a page that I would also like us to mark, which is pages 38 and pages 40. So that will tell us what actually needs to happen in our reflection, in our planning, in our implementation, and in our evaluation. So please, let's go to our manuals. Before I move to the next slide, let us do that. And then our competency standards are actually starting on page 60. You'll see that in our manual, we've got Annexure B, which is where our competency standards now are starting. Our domains, this is where they will start, the actual domains that we'll be submitting as CPDs. So those start on page 60 and they end on page 83. So very important, page 33 and 35, 38, 40, 60 and 83. Please bookmark those because they'll be very resourceful during this CPD training. Other resources that you have obviously are your tutor and the SAPC website. So Tabang has already gone through the annual declaration. Hopefully, this means that since you've gone through and you're in this workshop, you've done your annual declaration. And she's also stressed the issue of making sure that you tick the areas where you are doing most activities. So there should not be any place where you as an intern are ticking where you say that you don't do this activity or you do less of the activity, because as an intern, we expected to be a practicing pharmacist, so you should actually be doing most of the activities in the annual declaration. Otherwise, you'll be deemed a non-practicing pharmacist. Okay, hopefully everybody has got all their manuals and they've checked the CPDs, and we're about to move on now. So I think I'll try and say, let us start with the terminology. When we talk about a CPD, we've got 6 different domains. So the main area, we start with the domain. The areas will be a domain. It's different sectors that we will be doing our CPDs in. We've got a public health, which is the first domain. We've got a safe and rational use of medicines domain, which is 2. We've got a supply of medicines and medical devices, which is domain 3. We've got organizational and management skills, which is domain 4. We've got professional and personal practice, domain 5. And then the last one is education and research, which is domain number 6. So from this domain, from these 6 domains, each domain has got what we call a competency standard. And a competency standard contains behavioral statements. So I hope you are in your manual now. Hopefully, maybe you're on page 60. I think because page 60 is the one that will tell you about an actual domain, domain 1, and there'll be public health. And once you've gone to public health, you can see there's 1.1 for public health. That now becomes a competency standard within the domain of public health. And then when you go to 1.1, you've got behavioral statements A and B. So those are the statements that will assist you in completing your evidence under this competency standard. It will become more clear as we go along. But these are the 6 domains that we've spoken about. And the actual structure is as such that we've got a domain, and within a domain will be domain 1, for example. We'll have competency standard 1.1, and then we'll have competency standard 1.2. Under competency standard 1.1, we will have behavioral statement A. It can go to B, it can be C, D, E. The competency standards may vary. It may have more than one behavioral statement. So I hope that this is a little bit clear, because this is where we really need to get our competency framework together, and other than that, we'll be lost. But as I move along, I hope that we'll be looking at this from our manuals so that we'll be able to understand where I'm going. What I was saying before was that in domain 1, we've got public health, as I said before, and then under public health, we'll have competency standard 1.1, but this is the way it appears in our manual. Under competency standard 1.1, we've got 1, 2, 3, 4 behavioral statements. The behavioral statements are behavioral statement A, behavioral statement B, behavioral statement C, and behavioral statements D. But when we go to 1.3, I think, okay, let's go to 1.2. It might have behavioral statements A, B, C, and D, but it might be a different competency standard. So within a domain, which is domain 1, it's either you pick competency standard 1.1, 1.2, 1.3, 1.4, etc. You cannot say that when you pick your CPDs, you've chosen competency standard 1.1 and then you go again to 1.2. You need to have a competency standard in all of the domains. All right, so with regards to the structure of the competency standard, they form part of a domain. So how does it apply to you? So we at the level of of our internship, we're at the entry level. So that's the first 3 years of practice. So that means we'll be required to do the CPD cycle, starting with reflection, planning, implementation, and evaluation. So this will have competencies with behavioral statements, and it will be at an entry level. Intermediate level practice is from 3 to 7 years, and there's also advanced practice, but we will stick to the entry level. So going back, if you can go back to our manual. So if we go to our manual and we go and look at competency standard 2.6, so this is under the domain 2. I'm not sure if people can go there into the manual. Once you're on domain number 2, this is where now you will see that the competency standard here for 2.6 is pharmacist initiated therapy. That is our competency standard. And now we look at the behavioral statements. We have behavioral statements A, B, C, and D. So a behavioral statement is telling us what kind of evidence or what kind of activity or what kind of a behavior. This means it's something that we need to do. In our evidence, we call this a behavioral statement because the intern needs to show that I have done this in my evidence. Let us look at behavioral statement 2.6a. Behavioral statement 2.6a says that you are assessing and treating a patient based on objective and subjective signs and symptoms as guided by the relevant legislation and within the scope of practice. So the main things that I'm taking from there is that you need to assess and treat. So it's something that you need to do. So first of all, if you need to assess a patient, first thing that comes to mind is the history. And then you need to come up now with a treatment plan. And when it says objective and subjective signs, you need to know what your history is, and you need to have some sort of a guideline that will tell you that the reason why I am going into this treatment plan is because I've seen these signs and I've seen these symptoms. So that those are the things that you need to do as an intern. You can't say I've got a letter from the tutor that I have assessed and treated a patient. You need to actually show proof that the reason why, this is why what I've discovered I am treating, and this is how I'm going to develop a treatment plan. So it's things that you need to be done by the intern. As similar to domain 1, this is public health, you'll have competency standard 1.1, 1.2, 1.3, 1.4. These are all competency standard within the domain of public health, which is domain 1. Then we move on to the actual definition. So the actual definition of continued professional development is the process by which registered persons maintain and enhance their competence throughout their professional careers. So we as pharmacists are also taking part in CPDs. These are things that we need to submit to council to continue in our careers as professionals. So these will engage a range of activities. Some are supplementary training, some are informal training that we need to be continuously be part of. So all registered persons are required to do or to submit CPD activities. So this is not the end. You are starting off your CPD portfolio, but this is not the last time you'll be seeing a CPD entry. So I think I'd like to go now to the CPD cycle. Like we said before, if you can check in our pages, in our first checklist, we've got reflection, we have planning, we have evaluation, and then lastly, we have got implementation. So what does it mean when we're staying with reflection? So a lot of interns usually have an issue with the reflection and evaluation. Remember, the reflection might be the start, because this is when we are asking ourselves as interns, what do I need to learn? The evaluation is now your evaluating yourself. What I set out to learn in my first reflection, have I actually achieved it? Now you're assessing your plans, that did I actually achieve what I set out to learn? In our reflection, we are deciding, or we are finding out, what do I still need to learn? So reflection, again, what do I need to learn? And very importantly, what do I need to do? So reflection will contain a learning title. So if we've got a learning title, remember our learning title cannot be the same as our competency standard. So maybe let's say our competency standard is on health promotion. You cannot have a title that is exactly like the competency standard that you have. We will be marked not competent. So it should be relevant to what you want to learn. So you don't simply copy the words of the CPD, like I've said, that it will be not yet competent. And the learning title must be unique, and it must describe your case study. So if you're doing health promotion on the washing of hands, for example, and you're doing it in a nursery, that will be more distinctive, instead of saying health promotion with nothing else explaining what you're actually setting out to do. So in a reflection, there's a couple of things that we need to do before we start. We need to ask ourselves, what do I need to learn? Remember, that is your own learning need, and you look at what your surrounding is, what facilities are available in your facility in order for you to be able to collect evidence, use the right resources, and submit the evidence in time. So how do I know what I need to learn? What will I do with what I have learned? So you need to describe the learning need and make it personal. You need to be careful not to describe the name of the patient for confidentiality purposes. And it is very important that the learning need must be related to the selected outcome. Okay, so it must be relevant to the outcome that you set out to reach at the end. So if we can go back again to our checklist, remember our checklist is very helpful, and we'll find it on page 38. We'll go straight to what the checklist will look like. So every time we start a CPD, we need to go to the checklist and look at this. Do I have a title? Is the title short enough? Is it specific? Is it related to my competency standard? Is it concise? And make sure that it is in your own words. The reflection, remember, is that part where now we are asking ourselves, what do I need to know, or what do I need to learn? Have I started my learning need? What is it that I will need to collect within the facility that I'm at in order for me to be able to complete this? Have I stated why I have identified the learning need for myself? Have I made sure not to include details or planning and implementation here? So here it's just what I think I need to learn, or what I know. How do I learn this? So we look at the behavioral statements. The behavioral statements are key to us reaching our goals. So planning is now where we look at the resources that we are going to use in order for us to be able to answer and fill in the blanks where we now have our evidence to submit. We use behavioral statements in the planning. So how exactly am I going to learn this? So very important, do not only describe how you plan to proceed, but you must say what you're going to do, how you're going to do it, and why you're going to do it. For example, if you're going to be doing a health promotion, which resources are you going to use? How are you going to deliver that health promotion? Are you going to be using a PowerPoint? Are you going to be creating patient information leaflets? Are you going to be doing a workshop? How are you going to deliver that? And then also, why are you going to do what? How does it tie in to the actual title that you have chosen, and when are you going to do that. Remember, this is coming specifically from your primary learning need. So this will assist in, again, telling you what evidence you can submit to support your activity. So this is the time now you look in your facility. Do we actually do any health promotion? Am I going to be able to have an audience? Am I going to be able to present? Am I going to be able to have my resources within the pharmacy, or do I need to go and use a different facility? So those are the things that you need to be able to figure out before you start. So before you actually start your CPD, you should look at how you're going to cover your evidence. Is the evidence available? Is it sufficient from that place or in that pharmacy that you are situated? That'll go very into your planning, and it will assist you to make everything with the CPD a lot easier. So again, with our checklist, the checklist is telling us the very same thing. And it's assisting us. And remember, we still have to explain this in our CPD submissions. We've got different spaces where we actually need to say this is the portion for reflection, for planning, for implementation. The first question I think that came through in that first session was, do we have to submit evidence with each and every CPD? And yes, and the place that we submit our evidence is in the implementation phase. So the implementation place is where now we are completing all the activities regarding our CPD, and that tells us what we have done. So we need to be able to describe what we actually did. So we need to provide a context of what did I do, when did I do it, where did I do it, and how did I do it. So you tell the whole story, and you must keep it personal. It must be related to you as an intern, what I did, when I did it, where I did it, and how I did it. And very, very important, we need to link this to the evidence. So once you've told us, I have presented here, this is what I've presented, I've created a patient information leaflet, I've created a poster, you need to link it to your evidence. And the evidence needs to be linked to the behavioral statement. Remember, the behavioral statements are what we are supposed to be doing. So the implementation phase, another important fact is that it happens in the past. It's something that you have done. So it can't be, I'm still going to do this, I still have to do this. It's proof, or you're showing us what you have done. Then let's move to implementation. It's also available on our CPD manuals. Remember, implementation must be supported with evidence. If we do not have evidence, if you've given us a very, very good planning, very good reflection, the implementation, the notes are good, and the evaluation, but there is no evidence, you will still not be, we can't mark you as competent, because the evidence is what shows that you as an intern have actually done everything that you set out to do in your CPD. So the main thing that you need to make sure is there is the evidence. Without the evidence, you cannot pass or be said to be competent in a CPD. So another thing that we need to check with our evidence is that our evidence must be valid, which means it must be of this year, it must be current, and that means it must take place in the year of your internship. It must be authentic. It must be your own original work. And a good practice that we have is that interns must actually put their P number and the P number of their tutor as good practice to show that this is actually work that I did myself. It must be annotated. Annotated means it must be linked to the behavioral statement, and then again it must be linked to the behavioral statement. So your evidence must be clear, it must be readable, it must be not loaded upside down. You must have all the confidentiality information of the patient, the name, the ID number, the patient number hidden. We've had situations where interns have submitted a very good evidence, but for the fact that you have not covered the confidentiality of a patient, then that is unethical practice. The CPD automatically becomes not competent due to confidentiality. So please, ladies and gentlemen, let us first and foremost protect our patients, because we're using it to advance ourselves in our practice, but we cannot make you competent if you have not actually covered the confidentiality of your patients. The next thing that we go to is evaluation. So we look at what have I actually learned. Here in the evaluation, we're actually looking at the impact that this CPD has had on you. Maybe previously you could not counsel a patient, but you were given an opportunity for a counseling CPD, and you've learned the steps for counseling and you've actually put them into practice, and now you're going to use them in your daily function as a pharmacist intern to actually counsel patients further. So it must have impact. You must have started where you were not having enough knowledge, or the skills were not there, but then after the CPD, what have you learned and how it's going to benefit you in the future? So evaluations like, this is what I didn't know before, this is what I've covered in my CPD, this is what I've learned, and then this is what I'm going to use in future, or I'm going to now learn something on top of this counseling. So the focus here is the learning outcome must be related to the evidence. We've spoken about the knowledge that you've acquired, how it has impacted you. And now, again, we've said you're going to look at the identification of a future learning need. But it's not necessarily what you did, it's what you've learned, what you've achieved, and what you're going to, how you're going to use it further, and what other future learning needs that you have learned. But here it's very, very important that you provide examples of what your future learning need is. Don't necessarily just state without giving us an idea of, okay, now I'm moving on to bigger and better things. Again, this is available in our checklist. So remember, ladies and gentlemen, checklist, I'll reiterate it again, it's on page 38 of our manuals. Before we start a CPD, let us go through the checklist. So at each phase of the CPD cycle we've completed, we've got reflection, we've got planning, we've got implementation, and then we've got evaluation. So when we look at it, we first start with selecting a domain. Remember, there's 6 domains, and from the 6 domains, we choose one competency standard. So a domain can have one, or can have from 1 to 6 competency standard, and then a competency standard can have 2 or more behavioral statements. I've seen where there's one behavioral statement, but we need to be really careful of those competency standards. From then onwards, once we've started our cycle, now what we need to do, we need to enter and submit online for tutor verification. Remember, you need to give some time for the tutor to be able to verify before the CPD comes available to assessors. So once you've submitted your CPD entry online, you need to also remind your tutor, I have submitted, or tell them when they are ready that I am submitting so many CPDs, please verify for me, because if you have submitted and the tutor has not verified, we cannot have access to those CPDs. So that means I cannot assess a CPD that has not been verified. On the system, it tells us when the tutor needs to still verify your submission. So please ensure, and especially on those last days of the deadlines, make sure that you give your tutor at least 2 to 3 days so that they might verify your CPDs, because interns will tell you that I have submitted, but it doesn't show on the assessor side because the tutor has not verified. Okay, so once a competency standard has been chosen. You need to look for the appropriate setting, like we've said. You read all the behavioral statements. You decide on the evidence, at least 75% of the behavioral statements, and then you refer to the checklist. One thing I want to just go through quickly is the requirements for each CPD. You need to submit 6 CPD entries, 1 from each domain, like we've said, and you need to be competent in all CPD entries. So you read the behavioral statements carefully. We'll go through some of the behavioral statements just to see where we look at our evidence. 1 to 3 behavioral statements, evidence is needed for all statements. So this basically means that if you've got 3 behavioral statements in a CPD, and you've covered all of them, that means you've covered all 100% of your CPDs. We always say that you need to cover about 75% of your behavioral statements, but the point is, the more you cover, or if you cover all of them and you find that maybe some of them were not competent or were not relevant or were not good enough, you still have something else to cover you. So that is why I usually say, interns, please try to get the CPD that has got a lot of behavioral statements, because that means you've got more of a chance of passing than when you've got 1 behavioral statement and you miss that behavioral statement. That means your evidence will be non-competent. And again, ladies and gentlemen, let's try and shy away from any group activities. The work must be individual for each and every CPD that we submit. Let's try and do that. That's why we always say, for good professional practice, interns, please try and put your P number and your tutor that has assisted you, just to show that this is the work that I have done on my own. So requirements, for example, domain 1 for public health. If you can just go to 1.1 of our manual, that will be on page, the CPD entries are starting from Annexure B, which is on page 60. If you go to page 60 and we go to domain 1, when we look at the competency standard 1.3, versus 1.1, you'll see that behavioral statements under 1.1 is A, B, C, and D, while behavioral statements under competency 1.3 are A and B. I don't know, but for me, I would really like to tackle A, B, C, and D, because that means that I've got 4 chances to meet my evidence. So say, for example, I choose a competency standard 1.3, A and B, and A is very good evidence, is quality evidence, but B is the assessor is not happy with. That means that, unfortunately, I will not be able to be competent because I haven't reached the 75% of the CPD of the evidence in my CPD. So another tip is to just go for CPDs that are more than 2 behavioral statements. I don't know, I feel like usually if you miss 1, you might at least cover the 3. But when you got 2 behavioral statements and you miss 1, it's usually difficult for us to find more evidence or to make you competent. Okay, we've already looked at this. So again, criteria for our evidence we've spoken about, it must be annotated. Annotated, it means it's just not a label. You need to actually explain why you've got that evidence there. It must be current. So when you've got your prescription, when you've got your submission, when you've got your invoices, when you've got your receiving slips, there must be in the year of your internship. When the intern is loaded onto the system, we can tell that this is an intern from 2020, 2022, 2021. So you must collect evidence within your year. So if you were doing CPDs in your postgraduate and that was in 2021, and now you submit it as in your year of internship, that evidence will be not current and it will not be made competent. So again, it needs to be valid. when we're talking about standard treatment guidelines that have changed, for example, I know there's new art guidelines. You cannot be using guidelines that were set out in 2015 or 2017. There are new HIV treatment guidelines that are set, I think, in 2019, the latest. So do not use old, outdated information. It must be authentic. It must be proof that it originated from you. It was not group work. It's not something from your undergraduate year. The other thing we've spoken about, sufficient meaning it covers all the behavioral statements and it covers about 75% of them. I usually say go for 100% so that even if you miss one, you've got at least 75% that you still need to cover. Don't go for 75 because if you've missed one and it's not deemed as competent, you'll have to redo the entire CPD. So another thing to remember about annotation is that annotation is a mechanism to give meaning to evidence. So if you give evidence on a attendance register, you cannot say this is evidence 3. You know, what is it? It's evidence 3. This is my attendance. It's maybe you can annotate it by saying this is evidence 1.1a, which is pertaining to me promoting health, and this is the attendance register that I used to show that they were my participants. I've covered the confidentiality of my participants because they are patient. It's not merely a label. You cannot say I've labeled 1, 2, 3, 4, and 5, and then you don't have a meaning to that annotation. Another thing, it justifies the evidence. Why did I include this patient information leaflet? The patient information leaflet, I'm including it here because I want you to see where I got my resource from. Another thing, don't put in evidence that is blurred or is not readable. You also need to indicate to the assessor that in this patient information leaflet, these are the areas I have concentrated on. I've looked at the side effects, I've looked at the indications, and I've seen that the dose is correct for this particular patient. So it justifies the evidence. It's not just single words to say patient information leaflet or evidence or resource. It must, we need to, this is why I am doing this. You as an assessor, we need to see that, oh, this is what the train of thought the intern was going for. It must be planned and it must be meaningful. It must provide links to the behavioral statement. Like I've said, that I'm providing an attendance register because this I've had an audience. These are my audience, and it's pertaining to evidence to behavioral statement 1.1 A, B, C, or D. So it must tell a story of what you've done, again, to show behavior. So a meaningful annotation, for example, is where you've got a prescription, and on your prescription, you're saying, for the prescription to be valid, it must be presented for dispensing within 1 month after it was written. Thus, this prescription is valid, as opposed to this is the date for the prescription. It's a date for the prescription, and then what? Why is it important for me to be seeing a date? What evidence does it lead to? What part of it, which requirement does it fulfill? I'm not sure if it's making sense, but annotation needs to make sense. It needs to feed into the behavioral statement, and it needs to relate to the CPD to say, I know there's supposed to be a date in a prescription because it will make my prescription valid, and it will make my repeat. This will assist me with repeats, or it's a requirement that there must be a date on the prescription, not just date. Another example is, let's look at this evidence here. So I think maybe if we can have a look at this, when we're in the workshops, we used to look at how will you actually annotate this invoice. What are the important things that you need to show here? What are the things that you will assist in your evidence? Here we've got the name, of the pharmacy. We've got maybe the medicine that is ordered, the batch number, account number. You've here, this is an example of somebody purely labeling what we can see on the evidence, but it's not telling us why is it important for us to know the name of the pharmacy. Why should we check the name of the pharmacy? What purpose does it serve? The invoice, what relation to it? Why must we check the invoice? What is the importance of the batch number? What is the importance of the name of the medicine? So here, ladies and gentlemen, we are merely labeling. This is not annotation. It doesn't tell me what you know. What is the importance of the annotation here? As opposed to, maybe let's look at a more detailed one where now the intern has said, let's look at this part where the intern has said, this is relating to competency standard 3.2E, the end phase of the procurement of medicines. All right. Now I checked the medicine name, strength, pack size, and price. This relates to my SOP procedure where I need to check all these things. I've checked the batch number. I've compared the batch number of the invoice and the batch number of the physical stock to maintain batch traceability. The expiry date, it will assist me to employ FIFO and FEFO principles. Remember, when we are receiving our stock, we need to also check if the stock is receivable. Is it within a certain date? Is it short dated? Another thing is the parcel was received in good order. The medicine was not damaged or short dated. So this is an example of a good annotation. The intern is telling us why they're looking at these things, why they need to look at the name of the medicine, the badge. They're explaining why, and they're at the end coming back and relating it to the competency standard and the behavioral statement. Please note that the intern has actually said competency standard 3.2E. So if you've got more evidences, you should be able to have competency standard 3.2A, competency standard 3.2B, C, D, and E. This makes it easier for the assessor to say, oh, covered. But if you don't label your things and we must now put it together, it becomes difficult for us to tell where your story is coming from and what your understanding is of these things. So again, like we've said, CPDs must be current, so in the year. So you cannot use last year's evidence. Before you pick your CPD, you should be able to check if you are able to collect or complete those the evidence that is going to be needed. So don't include anything from your undergraduate years. Evidence must be specific and pertaining to the competency standard addressed. It must be factual. Again, when we see calculation errors, I know sometimes when we do the manufacturing, we might find that our calculations from our institutions may be incorrect. If you also use those calculations, your CPD might be deemed not valid. So please just verify your calculation and make sure that you don't have any calculation errors. Yeah, and the other thing is if the competency, okay, this was an example that we were given, that if now you want to tell us about frying an egg and how you go about frying an egg, your evidence cannot now tell us how crispy the bacon is. It must be related to the process of frying an egg. So your evidence must speak to what you've said and what is supposed to be expected in the competency standard. Again, very, very important, ladies and gentlemen, your work must be authentic. It must be verified by the tutor. And then again, what I will say is that it is your responsibility to check that your tutor has verified the work. Very, very important. I know tutors are busy with everything, but as an intern, it still remains your responsibility to say, I'm submitting on such and such a date. This is your due date. This is the cutoff date, and this is when I need my CPD to be submitted in, so that you're not submitting on your own and the tutor is not aware. So the evidence must be authenticated and must have your tutor name. It must have your signature. It must have a designation, and it must be a P number and the date. Intern must be also given and must also sign the evidence. For academic interns in manufacturing, evidence must be signed by the supervisor or the co-supervisor in case maybe you go to a retail pharmacy in order to fulfill some of the CPDs. But those are the things that are very important to authenticate your CPDs. We've spoken about the 75%. Oh, the other thing is that you cannot use the same piece of evidence in more than one CPD. So let's take, for example, CPD number 3.5. It's talking about medicine dispensing. And we've got a very large number of behavioral statements. I think they go from A up to G. But then you want to use that same piece of evidence in 4.3, where we're now looking at SOPs and applying policies. And because medicine dispensing is a policy and also an SOP, now you want to repeat with that evidence. Remember, you are assigned to one assessor, and an assessor will be able to look, oh, okay, so if I'm doing this, it's possible that you could have applied any other policy. And we do go back and check, oh, this is something that we've used before. And we have made CPDs non-competent because you have duplicated or you've used the same kind of evidence. Also, interns that are in the same institution, you cannot use the same evidence. I mean, if there's only one patient, maybe that has a very interesting case, but you still need to use it differently. You can't have the same CPD with everybody in the pharmacy. So very, very important to have your own work, and that work must be authenticated. I'll try and move a little bit faster. I'm not sure, we're supposed to go for lunch at a certain time, but I'll try and just move a little bit faster. So if there are 4 or more evidences submitted, they must be cover 75%. So make sure that you have enough evidence. Again, the focus is not on not only the quantity of evidence, but also the quality of evidence. So you've got one piece of evidence and you've annotated sufficiently and you've linked it to the behavioral statement. It is current, it is valid, it is authentic, then there's more chance for you to be competent in that CPD. The edit things that we need to stress that the link for each outcome and subsections identify with your own signature. And the date stamp are meaningless unless you authenticate and you identify yourself. You cannot be anyone in the picture. Okay, here I think another thing that we've said, we've seen some people saying this is me. They've got a group picture and then there's somebody that is standing in front of patient and it's you. Pictures are very nice, ladies and gentlemen, let me not stress, but I think we need to see the evidence more than the pictures. I'd rather see a poster that you've created, the resources that you've used for that poster, the attendance, the reflection that is coming from your patients, or the assessment that you did from them before you gave the talk. Another thing, when you are using the references, people have just shown a picture of a sum or a blurry picture of a certain section, and we're not sure what it is that we can't even tell which page number that resource is coming from. So a picture is good, but it also needs to be annotated. It needs to link to the evidence. It needs to show that out of this patient information leaflet, I'm going to take the indications, I'm going to take the precautions, and I'm going to take the dose in order to use it in my presentation. So it can't just be a nice picture, a front picture of a SAMF, and then we assume that you know everything there is about the standard treatment guidelines for diabetes. So let it make sense. Another thing is, what does this show? The stock was delivered, but was received by whom? Are the signatures correct? Are they annotated? Do they mean something? What is it that they are supposed to do? Remember, we need to make reference to GPP, to the Pharmacy Act. Go to that specific area and highlight why you are looking at a specific. Somebody will take a picture of the Pharmacy Act and nothing else is said about their scope of practice or why they've actually put the Act in. So it must be linked to the competency standard and very, very importantly, to the behavioral statement. So you need to put yourself in our shoes. What does it show? Will it point out a need for more discussion or more annotation? What is the point? What is the point of you putting something there? Let's go back to the pictures and the type of evidence. I think there was a question that came through. What type of evidence am I supposed to be submitting? Please do not put in highly glossy pictures. They're nice, but they usually take up too much space and it takes up more time for us to download those. And also, don't load them upside down, because now I've got the evidence, I have to turn it around, I have to link it. It's taking more time for me to read the evidence. The evidence must be clear and legible. Even your evidence, even your resources, they must be clear. It must be annotated. When you put a picture of a reference of a certain section of a pharmacology textbook, tell us why you're putting it there. What does it mean? What are you using it for? And the evidence must be in one document. Please do not submit 5 different PDFs, because when you have 5 different PDFs, it's 5 different PDFs, but it's a slide, and you end up taking more time. Now you have to put those PDFs together to see if they link, but make sure that you combine your PDF evidence into one single a PDF. Then it's easier for us to record. This also assists when now you're coming for resubmission, because I know, oh, this is the old evidence. The new evidence will be now the second PDF, and I can be able to see this is what I was missing before. I'm going to look for the second PDF because it's showing me what the new evidence is. Please, ladies and gentlemen. All right. The other thing is attendance registers, very important. Now we come to where we are presenting, and we need to also have the date and the presenter name and the venue. So there must only be one presenter. If you're in an institution and you are set dates and there's about 3 or 4 of you presenting, please let it be one. At least submit something that you have done individually. Like we've said at the beginning, no group is allowed. Another good practice is having feedback on the presentation. It can be feedback from your colleagues or feedback from the audience, maybe to reflect that they've now found new understanding and maybe possibly see where they didn't know and now what they know. Not necessarily where you're like, oh, okay, the presenter was great, the skills were, no, we want to see the impact of your presentation on the audience, not you improving your skills. Let it be more on the information that you've imparted on your attendance, on your attendees. So if we're looking at a situation where I'm providing information to the patient, what do I need to do? But if I'm providing evidence to a group, also, what do I need to do? So there's different kinds of evidences. I think we've covered the group issue. We've spoken about attendance register, presentation, reference materials, feedback. If you're consulting with a patient, history is very, very important. The actual treatment plan that you've done, consultation with the patient, and also the counseling that you will give to your patient. So everything that you do must be specific to that CPD that you're doing. Another thing is, remember, let us not use Wikipedia. Let's try to use more scientific references. We've got our old textbooks. We've got reputable sites. we've got GPP, we've got a lot of resources that are reputable within the pharmacy paternity. Let's stick to that. Don't put a link to Wikipedia, because it makes your evidence less reliable. So if we look at maybe, let's say we're talking about evidence of consulting with a doctor, we might look at the reason for the consultation, we look at the reference material, we look at the prescription that was used. So those are the kind of things that we need to look at. Remember, before you actually start your CPD, what will your evidence be? You need to be able to figure out, how will I prove this behavioral statement in terms of evidence? And it must be annotated. So another thing that is important is that if maybe we've attended a meeting and we need to show that I was there, I did, maybe I was going to do a workshop on applying new policies or SOPs or whatever, this is the thing that you will need to now provide. You might need to provide an agenda, an attendance register, minutes of the meeting, and then obviously what you have contributed in the meeting or during the meeting. It can't be a situation where you're like, oh, an attendance register, and you appear to be part of the people that were in the meeting. So I'll also be working with data. So you're looking at reasons for data collection, where you had maybe a screening report, you had data analysis, the different resources that you've used. Maybe you've used medical aids, you've used certain publications. What did you use? So that is a checklist for, I think the checklist we've gone over. Let's just quickly summarize. So evidence is proof of what I did. So without the evidence, ladies and gentlemen, like we said before, your planning can be great, your reflection can be awesome, your evaluation can be okay, but as soon as we don't have any evidence, we cannot give you a competent rating. So it must not merely be a reading an article, not theoretical scenario, not witnessing someone else do it. You must convince the assessor that I have performed the activity. So it mustn't be my tutor has seen me conduct communication with a doctor, with a patient, and it ends there. That is not sufficient. We cannot say that you have actually communicated with a doctor or a patient or a colleague. So the evidence must be clear and neat. It must not just be scribbled on a prescription. The other thing is that if you're asked to participate in a health campaign, maybe let's say you are looking at domain 1, there are different competency standards there. There are about 3 or 4 competency standards that we've spoken about. So when you go to behavioral, to competency standard 1.1, we have 4 behavioral statements. So in this case, this means now we need to provide evidence for competency standard 1.1a. We need to provide evidence on health promotion. What did you do to promote health? What do you mean by health promotion? How did you promote the health? When did you promote the health? Why did you promote the health? You need to provide advice on disease control and prevention. This will go under evidence 1.1b, where you're actually looking at how to prevent a certain disease. How do you control a certain disease, and how do you actually give that advice for preventing and controlling of diseases. Then we'll go to C, provide evidence on healthy lifestyles and participate in public health campaigns. What is a public health campaign? How do you go about this public health campaign? And this is what I did during the public health campaign. So here you've got a very nice long list of behavioral statements ranging from A to D. So those could be a very, I feel like those are good competency standards to go on, because if out of the 4 I've got evidence for A, B, C, D, and I've missed E, I've missed B or A, I still have 3 other behavioral statements that I have covered. So the learning title here we could use maybe participating in COVID-19 health campaign at Steve Biko Academic Hospital. Remember, it's not verbatim as the competency standard where you say health promotion of COVID-19. So it must be participating in something. The title must be related to the competency standard. So what has triggered my learning? My pharmacy manager asked me to participate in a COVID-19 health campaign, and I did not know what it entailed. Now you're assessing your need. Now you're looking, this is what triggered my learning. I need to learn how to participate and advise in public health campaigns. What do I hope to achieve? I hope to be familiar with the steps required to plan and successfully participate in a public health campaign. So as we move on to the plan, now we look at what do I need to do. I plan to make a poster. It must be valid, authentic, current, and sufficient. What resources I'm going to use: National Department of Health site, WHO policies and guidelines, SAPC website. I will include the following information: health promotion for behavioral statement A, healthy lifestyle for behavioral statement number C, disease prevention for behavioral statement number B. So you need to verify the poster with your tutor, use the poster in a health campaign, give feedback of attendance as in behavioral statement D, obtain the participation letter as proof that they were participants in behavioral statement D. I plan to participate in COVID-19 screening using screening tool D. And then ultimately, why I all this in order to be able to participate in a public health campaign. Very, very important, ladies and gentlemen, implementation. This is now where I need to look at my evidence. I've consulted the following resources, and there must be evidence. Remember, let's look at the annotation there. You're looking at annotation and you're saying, this is evidence A, 1.1a. I'm looking at WHO policies, guidelines, SAPC website. I have formulated a poster to use in the campaign. It's not just poster, campaign, or evidence C. So this is the poster that I've used. I've presented the poster. I did the screening using the screening tool. I received feedback from my supervisor, and I've obtained a letter for participation from Department of Health and Safety. So these are the things that I have done, not what my tutor has seen me or said I've done. So these are the things that are very, very important in the evidence, in the implementation, which is evidence. So again, let's summarize. You need to specify the source document, where it is, what it looks like, and even go as far as to actually go to the page and say why you have chosen such and such. And health education is a tool. You need a detailed poster, you need a pamphlet, you can have a presentation, a letter of participation, attendance register. Remember, if you're using patients, you need to cover the confidentiality. Where does it fit in the above? How many behavioral statements have I covered? Have I covered 3? But try to cover all of them, because once you've covered all of them, it's up to the assessor to say, oh, this person has covered all, and they might have missed 1 or 2, but ultimately the evidence is there. At the end, when we look at evaluation, remember evaluation, we need to look at what I have set out to do, how I provided advice and participated in health campaigns. I subsequently participated in a diabetic screening day. I would like to learn more on providing advice. This is the future learning need now. I am now more aware of public health issues, because before I was not part of it. I did not know. That's what triggered my learning need. Now I have learned. This is now what the skill that I have gained. I am now confident to volunteer and participate in other health campaigns. I'm not sure if this will be the right time for us to take questions. I've come to the first part, the end of the first part of our presentation. I'm not sure, because the last time I couldn't see the questions on my side. I'd just like to have a feedback if we're going for a break, or which is it? Are we going for a break now, or we'll continue? Tabang, are you there? Natalie, are you maybe there? I would just like to know if you'd go for a break.
Hello, Thokozani.
Hello.
Yes. Let's take the 10 minutes.
Thokozani, give me a sec.
Hello.
Okay.
I was saying let's take the 10-minute stretch break and then we will come back at maybe let's make it at 5 to 8.
Okay. No, that's
Okay.
perfect. I think
Yeah.
Adele, we'll come back at 5 to 8. In the meantime, maybe you can load from your side so we'll be able to control the slides. No, Adele, I can't see it for now.
Okay, colleagues, the time is 4 minutes to 8, and welcome back from the break. We're going to continue with the last part of our workshop, and Ms. Adele Nodia will be taking us through. Please make sure you pay attention because this is very much important. It will make you understand how you're being assessed on your CPD entries. And Adele, over to you. Thank you.
Hi, Tabang, can you hear me?
Yes.
Okay, thank you. Welcome everybody from my side. I'm Adele Nudia. I've been an assessor for Pharmacy Council for 6 years, and I will be doing the assessment part with you for the CPDs. And it's very important that you understand the assessment process and have a look at the resources that Council has included or have included in your manuals. So if we look at the assessment, it's mostly done on a scale of 0 to 3, and we will look at the grid on the next slide so you can have a better idea. For you to earn the 3 marks or to be successful, you have to adhere to all the requirements. You have to meet all the requirements for that specific cycle or phase within the CPD cycle. And in addition, for your assessor to give you 3 marks, you must make sure that everything is free of spelling and grammatical errors. You have used proper punctuation, your trade names is capitalized, and very important, Pharmacy Council's system does not do autocorrection. So what we usually suggest is do your CPD in a Word format, do your corrections, make sure everything is correct, and then you can just copy it onto Pharmacy Council's website. We find that works very good for interns, but make sure that your CPD has a professional look to it, that there's no errors. Assessment just goes very smoothly if you submit a professional CPD. So the 0 to 3, the 0 is not yet met. Then we have a partially met, a met, and a fully met. So if we have a look, you can look in the manual on page 33 and 34, and there you will find the manual, the checklist. So we have copied one in for you. So if you have a look at step 1, the reflection, you'll remember Tokozani said that you should have a descriptive original learning title that tells the assessor exactly what this activity is about. So if you have a direct copy of the behavioral statement, or it's similar to the behavioral statement, or it just doesn't make sense, you will get a 0. And if it's original and descriptive and we know what the scenario is going to be, then you will receive your 1. Same for the learning need. If it's irrelevant or it doesn't match the behavioral statement, or it's not related to the domain that you have selected, you will get 0. And on the other scale, if it's a clear learning need, we know exactly what happened, we know what you want to achieve, we know what you want to do, what you are planning to learn, what you want to know, what you want to be able to do, then you will receive your 3 marks for this one. So you can see the scale is from 0 to 3, and it ranges from not met up until fully met. So you can find this on page 33 of the manual. So what can you expect from us as assessors? You will remember that Tabang told you there will be feedback sessions later in the year, if I'm not mistaken, in June. So you can book a session, but if you don't need a session or you don't require feedback, it's not compulsory. But if you feel you need some extra assistance from any of the assessors, you can book for this. So what can you expect in the comments? When you submit your CPD and you get it back, you will see that you have a report. On that report, you will find comments from your assessors and moderators if the submission was moderated. So it will be dated. So it's very important that you look at the date, because sometimes submissions go from the assessor and the moderator back to the intern, and then there's another submission and there are comments again. So make sure that you look at the new comments, the latest comment. So it will be dated. You will either have some positive feedback. So the assessor will tell you it's a very good effort, or you are on the right track, but you need to do this. or it might be negative, and they will point out things that you did wrong or that you need to improve. And as Tokozani said, it's mostly related, or a lot of the cases are related to annotations. So your assessor will tell you it's a good effort, you're on the right track, but you need to provide more annotated evidence. So it's very important to go and have a look at the comments that you receive from your assessor, and you should use those comments as guidelines for the resubmission if it's necessary, or for other future submissions. So even if you receive your feedback from the assessor and you see it's a successful CPD, just go check if the assessor didn't give you any comments. So it might happen that the assessor thought, okay, we'll give the intern the benefit for this submission, but for future submissions, we would like to see the following. So even though a submission is successful, still go and check if your assessor didn't give you any feedback or any comments to improve your future submissions. So that's very important. As we mentioned, you are allowed to resubmit your CPD if they were not successful. What's very important on resubmission, fix the entry that is there. So if your assessor made a comment and say your learning needs should be more specific, or what's the knowledge or the skill that you need to improve, or your planning should be more specific. Say, for example, you stated, I'm going to use the Pharmacy Act. It's a very big act, so you will have to say, I'm going to use this section of the Pharmacy Act, or I'm going to consult section 2.1.7 in the GPP. So your assessor will tell you, please be more specific, go and fix this, or add some annotations, or what the case may be. Please do not start a new CPD. Fix the one that is already there on your dashboard, unless the assessor tells you to change it completely, but then fix that entry. And if it's necessary, remove incorrect evidence. You will see, we suggest that you upload one document, one PDF document with all your evidence in one document. But if there are more than one document on your profile, the assessor will assume that both of the documents are applicable to your submission. And if there were patient confidentiality issues in the evidence and you didn't remove it, the patient confidentiality issue still remains. So please remove evidence if it's incorrect, and just submit the evidence you want the assessor to look at. So see the guidelines for resubmissions, the conditions you can apply. If you do not agree, you can apply for reassessment, and the timeline. And very important, if you need to resubmit, or to minimize the need for resubmissions, submit early and submit regularly. You do not have to start with domain 1 to do your submissions. You can start with any domain that you would want to start with. If you first want to do 2.6 and then 1 in 3 or 1 in number 4, you can do that. You can submit one entry and see what your assessor tells you. You can submit 3 entries and wait for feedback. So that is totally up to you how you want to do the planning for your CPD submission. But what is important is that you have to plan. You have to start planning now, because if you looked at the timelines, if you want to write your exam in August, then you will be registered for more than 6 months. So that will tell you you have to submit 6 CPDs, and you will have to be competent in 3 of them. And if you look at the submission deadlines, then you should have submitted by the 10th of June. So it's very important for you to start planning your CPDs and decide when you're going to submit them. So to talk about reassessment, to prevent the need for resubmissions, make sure that you follow the recommendations that you receive from your assessor. Remember, if you send a resubmission to council, the same assessor will reassess you. So please do not simply resubmit without doing or making any changes, because the result will then not change. Because if the assessor told you there's not sufficient evidence on the resubmission, then there will still not be sufficient evidence. If you accidentally resubmit before making any changes, just ask your tutor to reverted back to you and not submitted to council. As Tabang stated earlier, you are allowed to submit 9 CPDs, so it's the 6 submissions, plus you get a 50% resubmission allowance, so that's 9, and then you will start paying a levy from your 10th entry. So if we talk about professionalism for your CPDs, please, plagiarism is not allowed. It's very important for you to name the sources that you use. Don't use fellow interns' material. Don't use undergraduate material that you've used for an assignment in your 4th year. It must reflect your own work, and any irregularities will be referred to the legal department of council, and you can be sure that there will be penalties applied. We have seen interns that submit the same evidence, exactly the same evidence, to assessors, and they have been handed over to council. So please make sure that you do your own work and that they are professional submissions. If we think about CPDs, I listen to a lot of interns and they say, "Oh, I have to do CPDs." A CPD is not just another hurdle. Once you get familiar with the CPDs and you actually see how you just structure your learning, because you are learning every day. So it's not just a hurdle, it's a way for you to structure your learning and just present it to council. And as Tokozani said, you will be doing this for the rest of your career as a pharmacist. So see this as an opportunity for you as an intern and a future pharmacist to develop in every area of your practice and your professionalism. So if you talk about confidentiality, it's very important that patient confidentiality must be protected at all times. So if you talk about patient confidentiality, it's prescriptions, it's trailer labels, it's the blue copies, it's the Schedule 6 register, and sometimes interns are so focused on their own patient, they submit Schedule 6 registered with only their patient blocked out and all the other patients are showing. So make sure no patient is visible so that we cannot contact any of your patients. So if patient confidentiality is breached, you will automatically fail the submission. So it will be not yet successful because of patient confidentiality. So even if it's authentic, it's current, it's valid, patient confidentiality breached is automatic, not yet successful. Please make sure that you completely obscure the name. We see a number of interns use these whiteboard markers, the black whiteboard markers. Just make sure if you scan the document, they sometimes become quite transparent. So then you can still see past them. So make sure what type of method you use to conceal. I'll show you an example. And please make sure that you remember confidentiality only applies to patients. Not doctors, not hospitals, not other facilities. It's not a staff attendance register. If you present something to the staff, you can have their name, their P number, and their signature. And be careful not to block too much information so that the assessor has nothing to assess. So it's not just a bunch of black blocks, so that's nothing to assess. Just block out what is required for us not to identify the patient. So if we look at these two, so this will be a good way to obscure and not a scribbly line where you still can see the surname, for example. So now that you are ready to start the stepwise approach for your CPD, and as Tokozani said, you will first choose your domain, then you will choose your competency standard. And this year, Council decided that we are going to provide some guidance to you as interns because we see that interns struggle to decide on a domain and on a competency standard. So how do we choose? And we see a lot of interns selecting incorrectly. So we are going to give you some guidance, and we're not going to spend a lot of time on every slide, but we do urge you to use this as a resource for yourself to study these suggestions by council. These are only guidelines, and it's not an absolute. The only exception is 5.3 that you need to do. But what we have done is we have listed the behavioral statements for you, or the competency standards, into 3 categories. And the first one is recommended. So this will be a good choice. It should present no problem to any intern if you should select this competency standard. The next one is possible. And there we said, consider this one carefully. And you should only choose this if you are able to collect valid and sufficient evidence. So, for example, if you haven't seen a product recall, it will not make sense to prove that you are able to do a product recall, for example. So the possible ones, you will be able to do it, but select them carefully only if you will be able to provide sufficient evidence. The last one, we have put that as a challenging one for you, and mostly they will be very difficult for you to complete with sufficient evidence. They are not impossible, but they are very challenging. So we would suggest that you look at the recommended and the possible CPDs when you decide which one you want to do. So you will see in the presentation, we have listed all the competency standards for you and a decision-making aid that you can use. And you can remember recommended is a good choice. Challenging then will be extremely difficult for you, and possible will be, for example, 1.5 is possible if you are actively participating in developing a disaster management plan. 1.1, it's a recommended one for you, but remember, this is about public health. So you'll see there is a decision matrix for you, or an aid for you, and then there are some comments. So you can see we have done this for every domain. And you can see domain 2, there's a lot of possible options for you. There's a lot of recommended options for you. And then you can see 2.8 will be very challenging for you if you are not involved in a registered clinical trial. So you can see it's possible. There might be an intern that is involved in a clinical trial, but it will be very challenging for an intern, say, working in a retail pharmacy to do 2.8 successfully. So challenging is not to be done, or you shouldn't select them, but you should select very carefully because you might not be able to provide the evidence that is required. There you can see again, 3.1, it's possible to do, but it will only be possible, my apologies, it will only be possible for interns in the manufacturing sector. We have a recommended, we have challenging, and we have a possible. You can see 3.6 will be possible, but only if the intern is exposed to a medicine recall. So you can see this is a very good resource for you to help you in your decision-making process when you decide which competency standard you want to attempt within each domain. So you can see we've done the same for number 4. There are some possible ones, some challenging ones, and recommended ones. You can see 4.6. This is for internal SOPs in the pharmacy, where you show how you are able to apply these. If we look at domain 5, you'll remember you will, there's a compulsory one, so there's no option for you there. And the last one is in domain 6. You can find the challenging, the recommended, and the possible. And you will see 6.3 and 6.8. We only recommend for academic interns, and there are some recommended ones for other interns as well. So you can see this is a very handy resource, and it will make your decision-making process so much easier if you look at this. So now you're ready to complete your CPD, and you log onto the system, and we are now going to look at the same table, but just some evidence that might be useful for you to use. But please remember, this is not the only evidence that is required to be successful. This is just the guideline to show you if you want to attempt this, you should maybe have this available, or this should be there. If you look at 1.5, for example, it's a possible CPD, but there should be a disaster management plan. So if you are a part of the team that's developing this plan, you are implementing this plan, then we should see the plan. We want the plan, and we want to see how you have developed it, how you've implemented it, and what was your role in this disaster management plan. And it's very important when we talk about this, don't only provide some evidence. Show us what you did with the evidence. How did you work with the evidence? How you are able to use the evidence and apply it in your daily practice, that you are now able to do this. So if we look at domain 2, we have some recommendeds, we have some possible ones. There you can see you will have to describe the nature of the problem, the consultation area for 2.1, the language that you've used, the sensitivity issues that you addressed, how you addressed them. If you want to look at 2.2, there we would want to see your counseling plan. We would want to see your patient feedback. You might include a tutor statement. So you can see there are some guidelines for possible evidence that you can include in this, but please take note, it's not the only evidence that you need to submit to be successful in these domains. So you can go through them. You can see it's very helpful for you as an intern. So if you select 3.1, it's for manufacturing interns. So you will include the quality assurance documents during the manufacturing process. If you go on, you can see, for example, 4.2, it's very challenging because there you have to include financial management policies, budgets, and there should be multiple activities. Also remember, it might be necessary for you to do 1 or 2 activities to achieve all the behavioral statements. Sometimes 1 activity is sufficient. You can decide what evidence do you need and how many activities should be included to achieve all the behavioral statements. So if we look at 5, the compulsory one for you is the legal one. You must include annotated extracts of the acts. For example, you state you are going to use the GPP, and I say I'm going to use section 2.6, include section 2.6 and annotate that and show how you used it. How did you apply these guidelines? How did you apply the GPP in this CPD? If you state that I am practicing a legal matter or in a legal way, provide the law and show us how you applied the law. If you evaluate a prescription, provide Regulation 33 and evaluate your prescription. You cannot include Regulation 33, just the document and a prescription, and state this prescription is valid. Show us how you evaluated the prescription to adhere to legal requirements. I hope that makes sense to everybody. So don't include just a page, as Tokozani said. Sometimes we find just a page scanned from the SAMF or the GPP. Show us why it's important. Why have you included this? Why is it in your CPD? The last one is domain 6. There you can see the decision-making aid again and possible evidence that should be included. For one, it's challenging because this is about pharmacy education. 6.3 is possible, but there you should be involved in undergraduate pharmacy education for pharmacy students. If we look at 6.8, it's challenging for interns. So look at this and use this as a guideline for yourself to make sure that you select the correct CPD. So if we look at the role of the tutor, it's very important that your tutor is a role model, and that implies an obligation to be competent and practice successfully and professionally. And as you know, your tutor also has to submit 6 CPDs yearly, even though they may submit a 2-step and the same 4-step as you. Use your tutor. Ask your tutor for assistance. Your tutor can be your mentor. So we as tutors, we can use this opportunity for self-development. We can use these mentorship programs as part of our own CPDs. So the tutor can use it for his own submissions as well. Tutors must remember also to do their annual declarations and include their 6 CPDs yearly. So the tutor verification, as we said previously, your CPD is not submitted to council unless it's verified by your tutor. This is very important. So if the deadline is the 10th of June and you submit on the evening of the 10th of June and your tutor is not available to verify, then your CPD is late and it will only be assessed in the next cycle. So make sure that you submit timelessly and you inform your tutor, remind them that there is a CPD. They will then evaluate the CPD entry, and we need to make sure that all the elements are authenticated and present, that the evaluation is there, the planning is there, all the blocks have been completed, and your evidence is uploaded, the correct document. Please make sure that you upload the correct evidence for your tutor to verify. If your tutor is happy with your CPD, they will release it to council, and then it will be visible to your assessor. If your tutor has suggestions, your tutor can revert the submission back to you, and then you can make changes and then submit it again for the tutor to release it to Pharmacy Council. We would ask tutors also to please assist the intern with assessor comments and to improve their CPD submissions so that we limit the number of submissions. So if you get the report, please show it to your tutor so that they can assist you with the changes that you need to make to successfully complete this submission. So the role of the tutor again, it's important that you note that the ultimate responsibility for your internship lies with yourself. You as an intern are responsible for the completion of your internship, and you have to familiarize yourself with all the internship requirements, but your tutor is also there to assist you and to complete your progress reports on time, to assist you with your CPDs, to verify them, to make sure that they are sufficient for council. And the tutor again plays a very important role in the intern's career, and it's important for a tutor to be competent and to give the intern some guidance, to provide interactive sessions with the intern, be empathetic and be supportive to the intern, and to build a relationship and really assist the intern to become the pharmacist that they should be. It's important for you to grow with your intern and to enjoy the journey, and to make them realize what this wonderful journey they have selected and they have chosen to be a pharmacist. So if you think about domain 6, tutors can use this for their own CPDs because they provide guidance and they provide education. So look at domain 6 as well for tutors for your own CPDs. And finally, for you as interns, take this opportunity to learn, to experience, to develop as an intern, to develop as a pharmacist, to develop as a lifelong learner, to be successful, and ultimately become a true lifelong learner in this wonderful profession of ours. So please complete this survey. It will be in the the Q&A message section. And now I think it is time for questions. So I don't know how we will be doing the question section, Tabang.
Okay, thank you so much, Adele. The questions have been published, so I will be reading them loud, and then colleagues will come in just to assist me in answering some. We're not gonna respond on the chat because some of the interns and tutors are joining on Facebook and YouTube, so that they are not able to see the responses. So that's why we have to read them and, we answer so that they can hear wherever they are. We will start. Let's see. Okay. Okay, the link to the survey has been posted. Colleagues, please make sure that you go there and respond like we have requested you when we started with our workshop. And then the first question, I'm seeing them from the bottom. So it means we'll be answering, I'll be reading them going up. Let's see. Yeah. Okay. The first one, it says, what does it mean if the annual declaration tab is not there on my profile? Usually the declaration, you do it once per year. And then once you have declared, you are also allowed to update. So I'm not sure what is it when you're saying it's not there. And in this case, maybe you can submit your query to the office, maybe with the screenshot, and then we will be able to assist you. Or maybe you can post your PIN number so that one of my colleagues from the office can check for you. But usually the tab will be there. And then once you have declared, it will also allow you to update. Then we will go to the next question. Will the slides be available so we can use them as a reference? Yes, the slides will be made available following the workshop that is going to take place next week, Friday, on the 18th. So you'll be able to access them from the website, from the 18th of February. Natalie, I'm struggling to find more questions. I'm only seeing these two for now. I'm not sure. How can I get access to others? Oh, okay. And then there is another question which was answered anyway. The question was, can we submit multiple CPDs at a time? And the answer was yes, but ensure that you have had an opportunity to gain experience in different areas of the pharmacy and have collected sufficient evidence to do so. So you can submit, but make sure that you have done justice to all the entries that you're submitting. And then the other question, I can see there are 60 questions published, but I'm struggling to...
Bang, would you like me to read the question?
Please assist me, Natalie.
Okay, I'm going to start from the top again.
Okay.
Please elaborate on submission of contract with tutor if you are continuing into 2022 from 2021. Does this involve fees again?
Okay, when you're continuing with the same tutor and at the same pharmacy, you don't have to pay any registration fee again. It's just a matter of notifying council that you're continuing, and you will only have to pay the annual fee.
Okay, does one have to attend all 3 workshops or the same information will be shared?
We will be sharing the same information in the 3 workshops. So if you feel you are not really happy with what you got today, you still want to attend, feel free to do so. But if you feel you're fine, then it's okay. Thank you.
How many CPDs can one submit at a time or before the deadline?
The number of CPDs one can submit at a time, it depends on an individual. Remember, we're not working at the same speed. But interns, they just have to make sure that they plan thoroughly so that they submit on time, and also to allow themselves time in case they are not successful in any of the CPDs. Because if you're not successful, it means you need to resubmit. So if you're planning it thoroughly, you'll have enough time even in case you are unsuccessful, so that by the time the exam comes, you will be ready.
Are there minimum word counts for each part of the CPD?
Yes, the maximum number of words, I think they are indicated there when they are submitting. Maybe the assessors can assist. I can't remember how many words they are supposed to be. Thokozane Adele.
Tabang, if I'm not mistaken, for the reflection part, it's 1,000 characters. But I know they have increased some of them. It's the number of characters. So some of them are 1,000, some of them are 2,000. But there's more than enough space for interns to describe in detail what they are planning to do. But yes, there is a limit on the number of characters. But as you stated, it is indicated in the blocks where you type in your planning on your reflection. The number of characters is indicated on the system.
Okay, thank you, Adele.
Can we record this session, or will a recording be made available?
Yeah, maybe that one, Natalie, you can assist. Usually the recording is made available, but Natalie can maybe respond to this one, please, Natalie.
Yes, the recordings will be available and the presentations will also be available on our website after the second workshop on the 18th of February. You can also access recordings on our Facebook and YouTube channels at Official SAPC. Good evening. Do we submit 6 or 8 CPDs this year?
Okay, nowadays we're submitting 6. It was the old platform wherein interns were expected to submit 8, but since SWEL we have changed. Now we need 6 CPD entries.
For the CPD entries, must your tutor sign on each page?
May you please repeat the question, Natalie?
For the CPD entries, must your tutor sign on each page?
Tabang, I will take that question.
Okay, yes, please, Adele.
What we suggest to the interns is to submit your CPD as one document. It's very nice to assess a CPD that has a whole storyline in one document. Then you don't have to switch between documents. And if it's one document, you can only sign the first page, and it's scanned in as one document. So the first page will be sufficient.
Okay. Thank you, Adele.
Good evening. For an academic intern's progress reports, are these submitted by the tutor or by the pharmacist supervising the 400 hours?
Deanne, may you please assist in answering this one?
Thanks, Tabang. So the progress reports for the academic interns follows the same process as previously. The only ones with which the interns would submit online is their proposal and their achieved degree. The remainder of their progress reports are submitted by their tutor, but the hours would be signed off by their supervising pharmacist. But the interns are welcome to email me, the academic interns, if they are confused by this at all.
Okay, thanks, Deanne.
For interns in manufacturing, who completes the progress reports that fall within the 400 hours? Is it our registered tutor or the supervising pharmacist?
Thanks, Natalie. So the supervising pharmacist needs to sign off of those hours. But the tutor, remember that the tutor remains responsible for the intern throughout their internship.
Where can one get practice exam papers for the exam?
The practice exam papers are available on the SAPC website, and when you log into your profile, you should have access to the practice exam papers. However, majority of these papers are from quite a while back. And for the updated format in the remote setting, we do conduct a practice examination, and the practice examination are set at specific dates, which you need to then log on those dates and complete the examination. And then you would get feedback after that examination in terms of which questions you got correct or incorrect. So there are not many past papers that are in circulation except the ones on the website.
Thank you.
Do we have to submit 8 CPDs in total, and can we submit more than one CPD at a time?
I think that one we have answered, Natalie. I said that was the old platform where they were required to submit 8 CPD entries. Now we're working with 6 CPD entries.
Okay, and then the intern exam will be taken from home.
Yes, Natalie. Interns would have the option to either write the examination at their place of work or at their place of residence. However, all of this information will be provided to interns at the examination workshop that will be conducted in May.
Great. Is it possible to fit in 3 progress reports to qualify for the August pre-reg exam?
Thanks, Natalie. Yes, all of the progress reports according to the date of registration would be possible, and the actual progress reports are listed by name when we send out the communication for booking for the August examination. So all of that will be sent out to the interns, but it is really possible to submit these progress reports prior to the examination being written.
If one wants to seed a contract with a tutor, how much is the penalty?
I'm not sure, but the intern can look for the amount on the board notice that has been published on the fees payable to council, but there is a fee that needs to be paid.
Thanks, Tabang. Tumelo has posted here that the fee is 1,456 Rand.
Okay, thank you.
Next one, do we have to attend the CPD feedback session if we have already submitted and been successful in all 6 CPDs?
There is no need really, actually, because the purpose of the feedback session is to assist those interns who couldn't make it, and also, to guide them on how they can get successful on their CPDs. So if you are successful on the 6 CPDs and you feel, there's no need for you to attend because you have already achieved. Thank you.
With the progress reports, are we supposed to submit them as stipulated in the intern manual, like at 6 weeks, etc.?
Thanks, Natalie. So the progress reports, yes, we do space them out in terms of the number of weeks of practical training that interns must complete. However, it's not limited to a specific date that it has to be submitted on. So it's up to your tutor when they will conduct that assessment and complete the progress report and then submit it. But there's no time limit that it has to be done at exactly 12 weeks from starting internship. So there's a bit of flexibility, but we would like for your tutor to submit the progress reports at those time intervals, because it gives us an idea of how you have progressed as an intern over the period of a year.
For the practice exam, are we required to book a month before the writing date like the pre-registration exam?
So the practice examination, the booking will open and the bookings will close, and all of that information will be sent to you on email. It's not as specific. We have specific dates that we need to meet in terms of the pre-registration examination, and that's legislated. In terms of the practice examination, we normally open it up a few weeks before the examination and then would close that, but you will receive all of that information closer to the time. The date of the examination is published on the website under the Interns tab and Examinations, and there you will find the date of the exam. And the practice exam normally is about 3 weeks before it is written. We would normally provide you with communication. You would then have the opportunity to log on and book, and then closer to the time the practice examination booking would close.
Where interns are required to do 400 hours, should the supervisors be registered tutors, or can we be supervised by any registered pharmacist?
You need to be supervised by a registered pharmacist. A pharmacist supervising you does not necessarily need to be a tutor.
When is the first attempt pre-reg exam for the newly registered interns?
Interns can only attempt the examination once they have completed 5 months, so they have to be in their 6 months. So for the majority of interns that have started at the beginning of 2022, your first attempt of the examination would be in August 2022, but that does depend on your date of registration.
Is the 10th entry before a liable fee is charged counted per CPD or overall submissions?
May you please repeat that one, Natalie?
Is the 10th entry before a liable fee is charged counted per CPD or overall submissions?
It is counted on the overall submissions. Meaning on the 10th submission, that's when we start charging a fee.
Okay, if there was a delay from SAPC to register an intern from the 1st of Jan, will they still be able to complete the hours?
Thanks, Natalie. I'm not too sure what the intern is requesting. So the delay in registration would not have been on the part of SAPC. If you would like us to review your registration date, you can submit a query and submit submit evidence in support of your application to review your registration date. But in terms of your hours, your practical training days are counted from the first day of your registration. So it's 365 days from the date of registration. And then that would be counted, and then that would also affect when you are able to write the examination. So I'm not too sure the query from the intern, but if they believe that they were registered late and they have got evidence to show that they were registered late, they are welcome to submit a query regarding their registration date. The application can be found online under the Interns tab, but they do need to submit that evidence along with the application.
As an academic intern, I'm currently in my 2nd year. I already completed my 400 hours. I'm busy with my CPDs. Is it necessary for the pharmacy to be registered as a training pharmacy to be able to validate my CPD evidence? I usually work in a hospital pharmacy which is registered, but I want to work in another pharmacy which I am not sure if they are registered as a training pharmacy.
Okay, yes, Natalie, the pharmacy must have been approved to conduct training, because remember there are minimum requirements for a pharmacy to train. So there are those pharmacies that they missing some of the requirements. That's why they are not training. So as much as we're saying you can be under the supervision of a pharmacist who is not a tutor, but that must be conducted in a pharmacy that is approved to train. Thank you.
If you accidentally resend a marked CPD without checking the report, is it possible to send to be sent back the original CPD with the comments that were sent?
Yes, if a CPD has been resubmitted accidentally, the intern has just to inform the office to say she has submitted the CPD that has already been assessed by mistake, and then IT will assist us in reversing that entry. It has happened before, it's possible, it's just a matter of the intern communicating with the office. Thank you.
Is it compulsory to start from domain 1 on our first CPDs, or can we start on any domain?
Interns are free to choose any domain, so it's not like it should follow any order. They can go to any CPD or any domain and start submitting. What is important is that they need to submit 6 at the end of the internship, and by the time they submit 6 anyway, it means they would have done all the domains because they're choosing one CPD from each domain. So they can start anyway. Thank you.
Can we clarify for academic interns who completed 400 hours and collected evidence in 2020 and 2021 and want to submit the evidence collected during this period now in 2022? Is such evidence no longer current?
Let me ask the assessors to assist with this one, please.
Hi, Tabang. When we see a submission, we see the registration date of the intern. And for evidence to be current, it has to be collected within the internship period. So if the intern was registered in 2021, for example, and they collected evidence in 2021, that will be acceptable, as long as it was collected within the internship period. Then we state that it is current.
Okay, thanks, Adele.
Do we need to cover the prescriber details on the evidence?
Adele, I think this is also for you and Thokozani.
Yeah. No, as we stated in the slide, it's only patient information and it's not required for prescribers or fellow healthcare professionals or hospitals, only patients.
Is there a maximum number of pages for the evidence?
Adele?
Hi, no, there's no page restriction. You can scan it in as one document and there's no restriction on the number of pages that you are allowed to submit. We do suggest that you submit, as I stated, one document. It's easy to tell the story in one document and not various pieces of evidence in various documents. So we do suggest one document, but there's no restriction on the number of pages.
Yeah, but I think the other thing is that please don't put the whole maybe training manual from your site or the whole SOP, because it might be bulky and we just need the specific areas where you've annotated or the parts that are relevant to the evidence. So don't now say, I'm going to put the whole manual, I'm going to put the whole GPP. Just put in the specific areas that are relevant that you're going to use for your evidence.
Can we submit sound files as evidence, for example, a voice note?
No, only PDF documents.
If I do a CPD on domain 1.1 and you promote health and wellness to patients, do you need to include an attendance list of the patients who you promoted the CPD to?
Yes, that would that would be a good piece of evidence. If you have an attendance register, just remember patient confidentiality, but that might be useful for you to prove that this actually happened. So that might be a good piece of evidence to attach.
Okay, Adele, the next question relates to that as well. How are we supposed to maintain patient confidentiality if we are using an attendance register for a public health CPD?
You just cover the patient's names. If you use a marker that you just take out the middle part, then you can see that various people filled in this attendance register and they've signed. So you can maybe just have a line through the signatures because you can't identify a patient through his signature. So there are ways to use an attendance register and, for example, don't do a patient name and a telephone number and a signature and a ID number. If you do that, then block that out in black. But you can just cover enough so that we can't identify the patients.
Okay, so reflection can be short as possible. Do you penalize on short number of words, like maybe 250 or 300 words on reflection?
No, not at all. If I know what you want to achieve, what your learning need is, what you want to be able to do, and why you have selected this and what you want to achieve, then it's fine. So it doesn't need to be 1,000 characters or 2,000 characters. If you can provide all the information in 250, that's fine.
Let's say I want to include a piece of information from a patient information leaflet. Should I cut that specific section out or include the whole PIL?
A patient information leaflet is not that big, so you can show us the patient information leaflet and just highlight maybe the relevant pieces. Where we don't want a complete document, as Thokozani stated, is the whole GPP, the whole Pharmacy Act, a whole document, but a patient information leaflet is not that big. If it's a big page, it covers the whole table, then maybe just include the pieces that are relevant, but we still want to see or write on it, it's the patient information leaflet for this product, so that we know where you got this information from.
I think another thing, cutting out that specific place, we won't be able to see where it's coming from, because remember, the patient information leaflet might have the name of the medication, the schedule, the trade name and whatever. So don't necessarily, you can't say you want to cut out a piece where maybe it's showing the dosage or the indication, because sometimes, like Adele is saying, that the patient information leaflet is not that big, but you need to just show us the specific areas that you're looking at. I wouldn't say cut out now and just put the part that you want to put, because now it gives the assessor a question of what am I looking at now? Which part is it supposed to fall into? So it must work into your evidence.
Pick the topics for our CPDs.
May you please repeat the question, Natalie?
How do we pick our topics for the CPDs?
Oh, Thokozani, I think that's what you were covering in your presentation.
Yeah, I think you look mostly at what is happening in your facility. What are the areas that you can cover? What evidence is available to you in your facility? So you don't need to go out necessarily to find the evidence. I think if we go back to, I'm going to try and look at the page now where we had a bit of a summary. I think page, what is it? Slide number 27, where we're actually looking at what are the things that are happening in your facility. You need to choose a domain, and then you start by looking at the behavioral statements. If you can cover all of the behavioral statements, if you can annotate the behavioral statements, if you can find evidence from the behavioral statements, and that's where you start. what evidence can I collect in my facility? I think that's where we need to start. That'll tell you how much, how to choose your competency standard. But also, the second part, we were looking at assessment. Adele did mention CPDs or competency standards that were a little bit difficult, were recommended, and others that were challenging. So we usually see that the ones that are recommended is the ones that most interns can find good evidence, that the evidence is sufficient, is valid, and they can authenticate it. So also use that as a guide to see which CPDs are challenging and which are recommended.
Tokozani, I just want to add to that. It's very important for interns to go and study Annexure B of the intern manual. So if we look, for example, in Domain 2, and you can see Domain 2 has various competency standards. So there's patient consultation, there's patient counseling, there are pharmacist-initiated therapy, there are a number of things. So go and look at Domain 2 and keep in mind what is available. And when a patient comes into the pharmacy and you have to do a counseling today, or you have to do pharmacist-initiated therapy where you had to look up something or you had to ask your tutor, that was a learning need. There was something that you did not know. So it's very important for you to look at Annexure B, look what is available. And then if something happens in the pharmacy and you said, okay, I didn't know this is a learning need, then you know exactly where to go in this domain and say, okay, then I did pharmacist-initiated therapy. I had a learning need there because I didn't know what to give to the specific patient. So 2.6 will be the correct choice for me for this domain. So it's very important to go and look and plan and look at Annexure B.
Will competency standard 5.3 be compulsory this year?
Yes, competency 5.3 is still compulsory. So that's the only competency that interns are expected to complete under Domain 5. Thank you.
May we shorten our evidence during implementation to E1 or E to A to allow more characters?
No, I think that's where we usually lose the plot. So do not shorten any annotation, be as descriptive as possible, because when you say evidence A and evidence, it must relate to a behavioral statement and it must be linked to a behavioral statement. So I would say maybe do not shorten.
As an academic intern, completing the annual declaration is challenging as I do not know if I answer as doing a competency as some of the time or most of the time.
Yes, it can be challenging sometimes, but the intern must feel free to ask the tutor, the fellow pharmacist, or they can even consult with us in the office if they need assistance. Because especially at the beginning of the internship, sometimes you're not confused. What is it that you'll be doing regularly and what are those that you'll only do them sometimes? So it's always good to consult. That's the advice I can give. Thank you.
With evidence, are we supposed to combine all the evidence of 6 domains in one PDF?
No, Natalie. When they submit, domain 1.1 will be, for example, 1.1 will be one submission with the evidence for 1.1. Then you will capture another CPD, so you will have 6 CPDs that's on your dashboard, and each of them will have its own evidence. So all the domains are not submitted as one. Each domain is submitted separately with its evidence.
Can one change a tutor without changing the practice institution?
Thanks, Natalie. So yes, you can change your tutor, but that still counts as a session of contract because you are ceding the contract from one tutor to another tutor. And you can also do a session of contract where you're changing facilities, where you would have a new tutor and a new premises. So it's the same application, it's an online application, it's session of contract.
Is there a CPD that needs to be completed specifically for manufacturing interns? On the tutor manual, nothing was specified. I'd like to clarify, please.
Okay, the CPDs were not classified as per sector of pharmacy in the manual. That is true, but the assessors and moderators, they felt they need to guide the interns when choosing the CPD entries. That's why that has been included in the slides. So the interns, they can consult the slides from next week so that they can be guided which CPD entries are maybe recommended for manufacturing. I'm not sure if Thokozani or Adele needs to add something from what I've just provided. Thank you.
Okay. If a tutor's approval as a training site and as a tutor is until 31 December 2022, but the internship period for the intern is from 12 January 2022 to 12 January 2023, does this mean the tutor will have to get new approval in order for the intern's training period to be valid?
Thanks, Natalie. Yes, the training period for the intern is only valid if it is with under the supervision of a tutor, as well as at a training facility that is approved for training. So as soon as the tutor or the premises is no longer approved, those training days will not count for the intern. So please ensure that we have an application for the premises as well as the tutor in enough time so that these can be approved so that there's no disruption in the intern's training.
Would we be required to register or book for the practice exam scheduled for the 2nd of June?
Yes, you are required to book for the practice examination. A few weeks prior to the examination, interns will be notified via email that bookings have opened, and in that same email, it will provide a date for when bookings will close. Interns do not have to complete any criteria or meet any criteria or complete any number of training days in order to book for the practice examination. So anyone can book, and you can complete the practice examination more than once. However, you do need to book your spot for that day, please.
Do we formulate our own assessment dates?
I'm not entirely sure what is meant by that question. No, dates and assessments have fixed times, both for CPDs as well as the examinations. Even the progress reports, there are stipulated times in which they should be completed at, but there are timelines for all of the assessments and evaluations.
Please assist. Where do I upload my proposal as an academic intern? There's no link on my dashboard.
So if you go under progress reports, there should be a link under progress reports. If you're having any problems, you can contact me and I can assist you. But all academic interns have the option to upload their proposal.
Where can we check the outcome of the practice exam we've written?
The practice examination will be available under examination results, and it should be available under there. Otherwise, there are always letters that are published. Even when you book for the examination or when you receive the results for the examination, under documents, you will be able to find all of that information that is emailed to you.
Can you suggest what type of evidence will be sufficient in order to prove that we have communicated telephonically with an authorized prescriber as part of our CPD 3.4G?
Well, there, I think with communication, you need to look at your communication skills, what types of communication you're going to be involved with, how you're going to communicate with the doctor, use references to maybe the prescription, maybe the resources that you're going to be querying, and how you're correcting maybe the mistake or the anomaly that has occurred within the doctor. But you need to describe how you're going to go about communication, what type of things you're going to be looking at during your communication. It can't just be, I have communicated with the doctor, my tutor has seen me speak to a doctor. If you need to speak to a doctor professionally, what are the key things that you need to be following and looking at when you're doing? So communication skills and the types of communication is what we're looking for when you're looking for communication.
If I can maybe add to that, we find that some interns are very creative with evidence. If you know the prescriber, you can maybe ask them for a letter or an affidavit that you have spoken to them. If your tutor is standing next to you, maybe they can state that the interaction took place. Maybe the patient is in front of you and they witnessed the communication. So there's a lot of things that you can use to prove that you actually spoke to the prescriber.
How long after we submit our last CPD can we write the pre-reg exam?
Okay, thanks, Natalie. The pre-reg exam, the dates are already set, and I can't say how long after they have submitted can they write. As long as they meet in the set criteria, they can sit for the exam. The criteria that we outlined in our presentation, where we said interns in their 6th month, they should have submitted all the 6 CPDs and be competent in 3. Those who are on their 9th month, or they will be attempting the pre-reg exam for the 2nd time, they should have been competent in all 6 CPDs and also have submitted the relevant progress reports. Thank you.
Okay, this looks like the last question. If I started my internship on the 7th of January 2022, will I be released for ComServe on the 7th of January 2023?
Thanks, Natalie. Interns need to complete 365 days of practical training. So if they started on the 7th of January, then they would be released after they have completed 365 days. So we do allow for release of interns over peak periods. So from the 15th of December to the 15th of January, interns are released a little bit earlier than when they've completed 365 days. And this is to ensure that we can process their application so that they can start community service. However, regardless of whether they are released a few days earlier or not, they are still expected to meet all the contractual obligations that they have with their employer. And they are expected to complete a full 365 days according to the internship contract. So that is the expectation, that they would be completing a minimum of 365 days.
Okay. I'm sorry, Natalie, you said that was the last question, ne?
Yes, Tabang.
Okay, thank you so much. I'm going to hand over to Mr. Mogano to do the closing remarks for us, and thank you so much, colleagues. Mr. Mogano, over to you.
Thank you, Tabang. I'd just like to thank all the interns for attending, making time available to attend this session. We wish you all the best for this year, and we hope that you are successful in everything that you do. Thank you, Thabang. Over back to you. Thanks.
Okay. Yes, thank you so much, colleagues. And we will be meeting again on the 18th of February, that is next week, Friday, from 9 o'clock till 12 o'clock in the morning. And you can let other colleagues who haven't managed to attend this one to book for the next session. The bookings are still opened online, and they will be closing, I think, the day before. And thanks to our assessors for the contributions, and to the office for being here and for your contributions. And thanks to the interns and tutors for making time to be here. And we wish you all the best. With these few words, I just want to say good night.